Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we talk about Lyme disease. I see that there's a number of new names here tonight, so for those of you that are new, welcome. I hope you get some value out of this and you learn some things that hopefully can improve your treatment or at least give you greater understanding of what's happening with this thing we call Lyme disease. I also see a number of familiar names returning, so I'm glad to keep returning and get some value out of this. During tonight's webinar, I am creating a recording, so if you happen to miss some of the things we discuss, don't worry, we'll be sending that back out to you in a recorded version, and that recorded version should come out to you sometime probably around 9:30 a.m. in the morning. At least that's what my goal is. I have to do some brief edits on it tonight and then get it posted, and I try to always write a little bit of a synopsis about it too that goes out in the email. So that'll take place tomorrow morning, and I'll get it out to you as soon as I have things ready to go. For those of you that have not participated, the way you can participate in these webinars is a couple ways. One, you can listen to the questions and the responses. Second, you can do is actually ask questions. The way you write questions is over on the right-hand side of your screen at the bottom is a chat box, and write your question to me there. The only thing I ask are two things. Number one, keep it brief. If the questions get too long, it's just too complicated for me to answer in this forum. And actually, extremely long questions will freeze up the computer screen, believe it or not. So I won't even bother posting now. And then the other, there was something else I was going to say. Anyhow, send the complete question to me by clicking the enter key. And remember, each time you hit the enter key, so like if you're trying to hit your enter key to create paragraphs, well, that each time you hit the enter key, it sends a question to me. So the easiest thing is make sure you complete the whole question before you hit your enter key. And if that means you have to write a big, long run-on paragraph, go ahead and do it that way. All right. During the webinar, I will be posting the questions on the screen. So those of you that are participating here in the live version, the non-recorded version, but the live version, will actually be able to see those questions on your screen. But I always do read them because people in the recorded version are unable to read the questions. Okay. All right. So I think that answers all the business background stuff we need to talk about. My intention is to do this as an hour and a half tonight. We'll see if I last that long. Sometimes I do tire out. Keep in mind, I'm doing this at the end of my clinical day. So it means I've already got a lot of stuff behind me in terms of work. So, but usually I make them for about an hour and a half. We'll see how that goes tonight. All right. So without any further ado, let's go ahead and get started here. Hello, Gail. Let's see. Hi, Dr. Ross. My brother's CCP antibody test is positive. Does that mean he probably doesn't have Lyme, but only has rheumatoid arthritis? Can people whose rheumatoid arthritis is triggered by Lyme have a positive CCP antibody test? Many years ago, he tested positive at LabCorp for Lyme, IgG P41 and P39. Could this be Lyme with these bands, even though he didn't meet CDC criteria? He had cat scratch fever as a kid, not treated. He is 60 now. He has bilateral joint pain and other symptoms. Also, for the first time ever, my TSA. Let's handle the second part of this in a minute. So about your brother, and then I'll talk about your thyroid question. I'll read your thyroid question. But anyhow, anti-CCP antibody, everybody, is a test that is used to see if somebody might have rheumatoid arthritis. And rheumatoid arthritis is a type of autoimmune illness where basically the immune system attacks your own tissues. Okay, it is possible. There's another type of rheumatoid arthritis test, which is called, which is an RA test, which is not specific for Lyme, not specific for rheumatoid arthritis, but could be also triggered from just having Lyme in you and when a person doesn't have rheumatoid arthritis. All right. So the question is, can Lyme trigger rheumatoid arthritis when somebody has a CCP antibody test? And the answer is maybe. I haven't seen any studies that actually studied that specific point, but you've got to wonder, when somebody has an autoimmune illness, what is it that triggered the immune system to attack your own tissues? Okay. And so it could be that he has rheumatoid arthritis as judged by this, but then you have to wonder, why did he get rheumatoid arthritis? And it is possible Lyme is the why. Okay. That's a little bit different than Lyme. So the Lyme itself is probably not triggering the CCP antibody. It probably is true that he has rheumatoid arthritis. But again, the question is why. Versus an RA test, if it comes back positive, can be caused by Lyme, and a person may not even have rheumatoid arthritis, for instance. Okay, so there's a little bit of a distinction there. All right. So it's possible that he's got Lyme triggering it. It's also possible he has two independent conditions. He could have Lyme giving him some of his joint pain, and he could have rheumatoid arthritis giving him some of his joint pain. Keep in mind, rheumatoid arthritis is not just diagnosed using a lab test. You've got to look and see if there's enough joints involved and where they are involved to call it rheumatoid arthritis. So the test is just one piece of the puzzle, but rheumatologists have a whole checklist of things they're supposed to go off of in terms of symptoms, which joints are involved, et cetera, before they formally call something rheumatoid arthritis. All right. All right, then let's see. And the next question was about thyroid. And it said, also, for the first time ever, my TSH is elevated to 6.790, and my anti-TPO and thyroglobulin are elevated. Nothing else. T3, T4, etc. is elevated. Should this be treated? If not, will it progress? So thyroid is always a controversial area. And so let me tell you how I handle it, and then I'll try to address how others might handle it, how the traditional community handles it. All right. So TSH, everyone, is a chemical made by your brain. It's called thyroid stimulating hormone. It's made by a part of the brain called the hypothalamus pituitary, and that part of the brain is the governor of your thyroid. And if the brain is interpreting that there's not enough thyroid in you, it will manufacture higher amounts of TSH to tell the thyroid gland to make more thyroid, okay? So elevated TSH means low thyroid, okay? And that can be confusing, all right? But elevated TSH means your brain is screaming at your thyroid saying, make more stuff, okay? All right? So elevated TSH probably means you have low thyroid. Now, you can have low thyroid and still have T3 or T4 thyroid, which are the two kinds of thyroid hormones made by the thyroid gland. They can still fall in the normal range, but it may be that and that's because your brain is sending signals to correct for it, or it is that it's in normal range, but you might do better if it was higher in normal range. Okay, so the standards are most labs will report a TSH as being elevated if it's above about 4.5 or 5.0. What is interesting, though, is the American College of Pathology, probably over 10 years ago, the pathologists came out with a new standard and said that we should consider to be elevated if it's about 2.6 or higher, but most of the labs have not changed their standards. And here's what the difference is. So whenever in medicine we determine what a normal lab is, we basically take a bunch of people that we consider to not have the illness because we don't have any symptoms of it. And we wind up doing blood testing of a large population that doesn't have symptoms of that illness. And we look to see what are their levels. And we artificially determine that anyone that falls within 95% of the average or 2.5 standard deviations of the mean, we call that normal. All right, so everyone, you know about the bell-shaped curve, right? So there's one end of the bell-shaped curve, and then it goes up, and then there it comes back down. There's another end of the bell-shaped curve. And what we basically have said is everyone that's included in that bell-shaped curve is normal, except for the tail end on this side and the tail end on that side. We call them artificially abnormal. Okay, that's how normal is determined, all right? Normal is what's in 95% of this bell-shaped curve. All right, now, there's been some studies done looking at these people that supposedly had no signs of thyroid And they went and then did ultrasounds of their thyroid. And they found that there were a percentage of people that had swollen thyroid that could only be detected on ultrasound. And if you remove those people from the studies done on normal range, if you pull out these people that don't have swollen thyroids, and then you go back and look at what falls in 95%, is people that have TSH less than 2.6. All right. So probably above 2.6 or higher means you have thyroid illness. Now, for whatever reason, there's a bunch of doctors, no one is following these new guidelines by the American College of Pathology. All right. So to me, that is actually elevated. And I usually will wind up trying to treat to get the TSH so it's at 2.6 or lower because people feel better on that thyroid. The other thing is you have elevated antibodies against your thyroid. That's this anti-TPO and thyroglobulin that you're telling me about, which means you have autoimmune. It means that your thyroid is being attacked by your immune system. Now, again, Lyme can trigger that, okay? So if you happen to have Lyme, one of the treatments to stop this from happening is treat the Lyme. The other thing I have found to be useful in situations like this to get the autoimmune attack from happening is to go on something called low-dose naltrexone. So let me talk about that real quick, and then I'm going to show you an article that talks about thyroid testing and talks about what to do about how to use this thing called low-dose naltrexone as well, too. All right, so low-dose naltrexone. So there's this medicine called naltrexone, all right? And then when we use it in autoimmune illnesses, we use it as low-dose naltrexone. So what's the difference? So naltrexone is a medicine that was designed as a narcotic blocker. It's something we give to people that have drug overdoses from narcotics. And it binds to narcotic receptors in the body, bumping off the narcotic that somebody is addicted to and is causing them not to breathe, for instance, okay? All right. So if you went to the emergency room and you had a narcotic overdose, you would get naltrexone, all right? Now, we manufacture a group of chemicals called endorphins, which are our natural narcotics. And those endorphins that we manufacture do a number of things. One of them is they regulate pain. They bind to endorphin receptors, our natural narcotic receptors, and they regulate pain. Second thing that those endorphins do is they regulate the immune system, okay? And so what happens is if you can go ahead and provide a temporary blockade of the endorphin receptors, there's two things that happen. Those endorphin receptors become more sensitive to any endorphins that are out there. And secondly, the brain does not like the fact that those endorphin receptors are blocked, and it sends out signals to the endorphin producing cells in the body and tells them to make more endorphins, all right? So when this temporary blockade of the endorphin receptors wears off, then what happens is you got these receptors that are much more sensitive to endorphins, and they get flooded with excess endorphins that the brain is told the endorphin cells to make. And what that can do is over time, over about a 6-month period of time, that can re-regulate an immune system that is attacking you. Okay, all right. All right, so the reason it's called low-dose naltrexone is naltrexone is manufactured as a 50 milligram pill. But if we used a 50 milligram pill, there would never be a temporary blockade of the endorphin receptors. It would just become an ongoing blockade. If we use a dose of about 1.5 to 4.5 milligrams, that's low dose naltrexone, after about 4 to 6 hours, that blockade of the endorphin receptor will wear off. And then those receptors can get flooded with the extra endorphins and be more sensitive to hold on to those endorphins and respond to them too, okay? So that's how low-dose naltrexone works. You would start at I usually start people at 1.5 milligrams one time a day and do that for 2 weeks. If they're tolerating it well, then I go up to 2 of those pills or 3 milligrams one time a day for 2 weeks. And if they tolerate that, then I go up to 4.5 milligrams. I like to have people take it in the morning. The European physicians tend to have people take it in the morning. For some reason here in the States, we got an idea that we should give it at nighttime. But the trouble is at nighttime, it actually can cause insomnia. So even though that is the prevailing way how doctors do it here in the States, I do it the opposite way. The reason doctors do it that way here in the States is have a natural cycle of endorphins that they tend to become much higher in the middle of the night. And so the thought would be we do the endorphin blockade at nighttime, have you take it at night, and then we could ride on the fact that you have a natural elevation of endorphins at nighttime and maybe get better results. But the answer is you don't. And it usually screws up sleep if you have it at night. So I tell people to take it in the morning, okay? You want to give it a good 6-month try before you say yes or no if it's going to work too, okay? All right, so let me just do a quick screen share here for you. All right, so, wait a minute, what am I doing here? There. All right, so this is, oh, wrong site. Well, this is my supplement store, but this is my Lyme disease information site. And let's see here. So if you take a look at my online Lyme guide here, and if you take a look at, what do we want to do here? Trying to remember what I was talking. Oh, yeah. Okay. So we want to look at our immune system chapter here. And in terms of naltrexone, take a look at this article called LDN for Lyme. It's where I talk about how to work with this, why it works, what are the side effects, etc. Okay. All right. The other thing that you might want to take a look at is my article on thyroid illness. And you can find that in the hormones section here. And take a look at this article called Hypothyroidism, the Best Test, Meds, and Vitamins, okay? And that's your comprehensive article about there. And I think in there I talk about the low-dose naltrexone as well, too, okay? All right. So let me go back here. Actually, let me look at one thing here. Okay. All right. Get out of that. Okay. Let's see. Okay. There you go, Gail. Thank you for that question. Good luck to you. And good luck to your brother. All right. Bye-bye. Hello, Dominic. Hi, Dr. Ross. Can I safely take liposomal glutathione and thorn 500 curcumin 1 pill 3 times a day together? Do you think these supplements alone would help with inflammation and fatigue? I believe I'm having a cytokine flare-up. Thank you. All right. So everyone, so I'm going to answer that question, Dominic. Well, the answer is yes, you can take them together. That's the brief question. But let me explain why you're using those and why you might want to use those. So when you have chronic infection, or if you have too many mold toxins in you or too many yeast in your intestines, your immune system is going to try to get rid of those problems. And one of the things that happens is white blood cells will manufacture a group of chemicals called cytokines. Cytokines are good. They turn the immune system on. They help it work better. They draw the white blood cells to where the infection is or the mold toxin is. And that's what's supposed to happen, okay? Now, in Lyme and in yeast, in your intestines, that is, and in mold toxin illness, often the immune system does not do a good enough job getting rid of things. And so what can happen is it will try harder and harder, and eventually it's going to make too many cytokines, okay? And too many cytokines give you fatigue, make you hurt all over, can give you brain fog, can interfere with how your hormones work, can disturb your sleep, etc., right? So those are what we call Lyme symptoms. Lyme symptoms are really too many cytokine symptoms. Mold toxin symptoms are really too many cytokine symptoms, okay? And yes, those increased cytokines can give fatigue as well too, okay? So could you help yourself by lowering cytokines to help with some of the fatigue? Yeah, you could. And so usually I like using curcumin. Curcumin is a component of turmeric. It gets inside of white blood cells and limits cytokine production. All right, so you can kind of think of it as blocking the factory. It disturbs the factory production line, all right? But the other thing that happens is white blood cells have to get signals that tell them to make cytokines. And that's where glutathione comes in. Glutathione is a very strong antioxidant that blocks oxidizing agents that trigger the white blood cells to make cytokines, all right? So they're working two different ways to lower cytokines. Glutathione is blocking the signal or the ordering form that goes to the factory, and curcumin is in the factory blocking and interrupting the production line. So you get an added benefit of using both of those. And so usually the products you mentioned here, liposomal glutathione, the reason I like using liposomal glutathione is you want to use a product that's going to be well absorbed. Regular glutathione is usually not that well absorbed. The product I like using for liposomal glutathione is a product that's made by research nutritionals called Trifortify. They've got great studies showing increased absorption. So that's why I like using it. I see good benefit in my practice as well too. Usually a teaspoonful one time a day, which is about 400 milligrams, okay? And then the curcumin, I like using the Thorne Mariva 500 because it also is a liposomal product, and curcumin is poorly absorbed unless it's prepared to be absorbed, and microscopically wrapping it in fat as a liposomal form is how you get it well absorbed as well too, okay? All right, so let's see here. Do you think these supplements alone could help with inflammation and fatigue? The answer is yes, help with inflammation and could help with fatigue as well too, okay? All right. Good luck to you, Dominic. You do another quick screen share here. Okay, so, all right, so I've written a whole article about cytokines. If anyone wants more information about them, take a look at the chapter called Herxheimer and Cytokines. All right, and this section right here is where I talk about what to do, including using glutathione and using that curcumin are two of the big ways I like to approach it, okay? All right, Dominic, thank you. Good luck to you. All right, let's see. Hello, Lynn, let's see. Hi, Dr. Ross. I've been taking Capri Plus 2 pills twice a day for a couple of months, and I'm only seeing modest improvement in my yeast overgrowth symptoms. I would like to stick with herbal treatment at this point. I'm wondering if I should increase the dosage of the Capri Plus, or if I should switch to another herbal regimen, or maybe combine things. Can you share your thoughts on this? Yeah. So everyone, what Lynn is talking about is treating too many yeast in her intestines, or we call that intestinal yeast overgrowth. At least I think that's what you're talking about. Yeah, you used the word yeast overgrowth. So yes, and so symptoms of yeast overgrowth can include gassiness and bloating. Sometimes yeast release toxins that interact with your skin that lead to pimples and acne or worsened rashes. Too many yeast can give vaginal itching, vaginal discharge in women. Too many yeast can increase sugar cravings. And then when you have sugar, if you have too many yeast, it can make you feel worse. And too many yeast trigger excess cytokines. Okay, so I like to think of too many yeast, especially if I've got somebody that's been getting better with their Lyme or old treatment, and suddenly they do worse. I start wondering, did too many yeast move into the intestines, basically? Okay. All right. In fact, 80 to 90% of the time I see a decline in somebody after they've been doing better, it's probably too many yeast in the intestines. All right. So approaches you can do, the ones that tend to work the best are pharmaceutical. You could do a nystatin diflucan combination, and usually in a month, that'll work 90% of the time. But Lynn's preferring to go herbal. And if you go herbal, generally working with herbs, an herbal approach will work about 80% of the time over about a 2-month period of time, okay? But if it's not working well enough, there's some things you can do to fine tune that. So number one, and this is something you should do whether you use the prescription option or whether you use the herbal option. But if you're either using prescription or herbals and you're not getting better, then the first place to start is look at your probiotics and put more in, Okay, so regimens that are going to do the best at getting rid, so you want to make sure that you're using probiotics to take over territory from the yeast. And there's two general classes and families of probiotics that many of us are working with now. One are made up of normal bacteria that live in your intestines, okay, that live in human intestines, I should say. The other is a group of probiotics that we call spore-forming probiotics. And spore-forming probiotics literally develop a spore, a hard covering around them when they're under stress or they're outside of soil or they're outside the intestines to protect them, all right? Now, these spore-forming probiotics tend to do, it's not clear whether they actually repopulate your intestines, but what they do is they support the normal bacteria that are there to grow better and to extend their territory, okay? And they support the actions of the probiotics that you're putting in, the other probiotics that you're using, okay? So there's a number of ways you can do this. So number one, there's a product by Research Nutritionals, which is called Multibiome. And it is a non-refrigerated probiotic that has in it human strains as well as soil-based spore-forming strains. A normal way of taking that would be 1 time a day, but if you're having a hard time, or 1 pill 1 time a day, but if you're having a hard time getting rid of yeast, I would start that at 2 pills 1 time a day. Okay, so it's Research Nutritionals and it's called Multibiome. Okay, the other option would be to actually get separate human strains in a product that has separate spore-forming strains. The human strain one I like using is a product called HMF Forte, which stands for Human Microflora, okay? And I would do 2 pills 1 time a day of that. And the spore-forming probiotic I tend to like to use is made by Research Nutritionals also, and it's called Corebiotic, and I would do 2 pills 1 time a day of that. And you can take those probiotics all together at the same time, all right? The other thing you could do is to try to increase the Capri Plus up to 3 pills 2 times a day. That's one option. Or you might want to look at a separate product. Okay, so Capri Plus has in it caprylic acid, some oregano oil, and a little bit of garlic. Okay, but the main thing in it is the caprylic acid. The other option you could look at instead of continuing with the Capri Plus would be to change over to a product by Integrative Therapeutics called Phytostan. That's Phytostan. And Phytostan has in it some caprylic acid, rosemary oil, thyme oil, endolysinic acid, and powder co. It's got powder co in it as well too. So it's a different combination that may work better. If you were to do it though, typically I would start people at 2 pills twice a day, but since you're already having a hard time, I would do that as 3 pills twice a day. And to that, I would add 1 crushed clove of garlic a day, all right? And so how would you take that? Well, you got a couple options. One is crush it or press it with a knife, 1 clove, not a head of garlic, but a clove of garlic, an average size clove of garlic. Press it with a knife, take the skin off, or crush it in a garlic press, okay? Put it in water and drink it. All right, that's a quick way of getting it in, all right? Or you could take that pressed clove of garlic or crushed clove of garlic, chop it up, throw it across your salad, and get that in 1 time a day, all right? But it has to be raw garlic. So why would you crush it or press it? Well, there's a chemical in garlic called licinin that is activated when you press or crush garlic, right? So, and you want that to be activated. And if raw is better, it tends to be more active if you use raw garlic, okay? So sometimes I have good success, and sometimes if I've got somebody that's, for instance, doing a nystatin and diflucan combination prescription-wise, and they're almost there but not all the way there, I sometimes will have them add 1 crushed clove of garlic in a day. And that often takes care of it for people too, okay? So that's kind of my little trick I've learned over time is if things aren't working, add a crushed clove of garlic And usually 1 clove a day is not going to have you off-gassing like a vampire, or the way that people would if they're trying to keep vampires from showing up. Usually 1 clove a day is not going to add a lot of odor to you, so you can still be around other people. Okay, all right. So Lynn, I'm thinking this through, you could just switch over to Phytostan, 3 pills twice a day, add a crushed clove of garlic, and then increase your probiotics by either multibiome, 2 pills 1 time a day, or HMF Forte, 2 pills 1 time a day, Corebiotic, 2 pills 1 time a day. Okay? All right. Good luck to you. All right. Let me just do a quick screen share here again. All right. So everyone, this is my supplement store. It's Marty Ross MD Supplements, and this is a store for anyone. You don't have to be one of my patients to use it, okay? I make this available to everyone, though, so that you can find high-quality products that I have found successful in my practice, basically, all right? And I offer them, if you have a minimum purchase of at least $50, we ship for free, and I cover the taxes. So if you happen to be in a jurisdiction where you would have to pay taxes, I'm covering that for you too, okay? All right. So we ship out of Austin, Texas, which means we can meet most places in the country pretty quickly. And so let me show you what you want to look at in terms of probiotics here. Okay. So this is the Corebiotic I was telling you about. This product here is the HMF Forte I was telling you about. And this is the newer multi-biome product by Research Nutritionals that I'm having quite a bit of success using as well too. Okay. And then in terms of looking at what you can use to kill the yeast, take a look at this section here called Yeast. And this is that Capri Plus we were just talking about. And this is the Phytostan product that we were just talking about as well too. Okay. All right. All right. Good luck to you, Lynn. Hello, Nancy. Happy summer, Dr. Ross. Thank you. Happy summer to you, too. Let's see. After living on mainly fruits for a couple weeks, I noticed my fatigue returning when I had a meal of quinoa and cooked veggies. Same with oatmeal. Basically, I'm down to eating mostly raw fruits. Wondering if certain foods are creating inflammation in my body. Can you please advise on fatigue and possibility of food-induced inflammation? My main symptoms have been fatigue, heat, shakiness, migrating joint pain, blurry vision, and random tongue lesions and tender soles of the feet. All right. So Nancy, to give you the best answer, I would need to ask you a lot of questions. Unfortunately, I don't get to do that, but I'm just going to make some general comments, okay? So when I see a situation where somebody's diet is getting more and more and more restricted because they start reacting to everything, or more and more foods make them worse, I start wondering about leaky gut syndrome. And so let me talk about that, and let me talk about the main reason people get leaky gut syndrome. So leaky gut syndrome, everyone. So I'm going to is basically to describe what it is. I want to talk about how typical intestines work, and then what happens in leaky gut. So your intestines, you basically got the inside of the intestines. That's where your poop is. Okay. All right. There's no easy way to talk about this. All right. All right. And then what keeps the stuff in your intestines, the poop in your intestines, from reaching blood vessels is one layer of cells. All right, so you got the inside of the intestines, one layer of cells that touch up against each other very tight, and below this one layer of cells, you've got blood vessels. All right, separating this layer of cells and the blood vessels is 60 to 70% of the body's immune system, just sitting right there in the intestinal lining. 60 to 70%. Okay, that's where 67% of your immune cells are. All right, now. In healthy functioning intestines, what happens is the stuff that's here does not get into the blood vessels unless it gets absorbed into these cells. These cells provide a barrier, especially if they don't have any gaps, okay? And in healthy functioning intestines, where you got good bacteria, and you've got a functioning digestive system, basically food is digested with due to acid in the stomach and enzymes that are made by the pancreas into small parts, and then healthy bacteria that line the intestines do micro digestion of the food, breaking corn proteins and corn sugar into amino acids that aren't recognized as coming from corn anymore, and into glucose that is no longer recognized as coming from corn or carrots anymore, okay? And so you basically get microscopic particles of food that aren't even recognized as coming from that food anymore because they're so micro-digested. They're what get absorbed into these cells. And they pass from these cells through all of these immune cells here into the bloodstream, get absorbed into the body, and they never trigger these immune cells here, okay? All right, because immune cells just sees them as a piece of sugar, sees them as an amino acid piece of protein, sees them as a small particle of fat, but because it's been so micro-digested, it doesn't reflect which food it originally came from, all right? That's healthy intestines, all right? Now, what happens if you've got an infection on these cells, which could be due to a parasite infection, could be due to too many yeast living in the intestines. Sometimes maybe even Lyme can give some of this infection stuff going on here. These cells swell up and pull apart. Now you got gaps. And you get things that aren't micro-digested anymore that start leaking through here. That's why it's called leaky gut. And guess what they hit? All these immune cells sitting here, okay? And these immune cells now see micro pieces of corn, and you'll start having an immune reaction to corn, all right? And they start seeing micro pieces of carrots, and you start having immune reactions to carrots, all right? So when I see a picture where somebody is getting more and more sensitive and reactive to various foods, I have to wonder about leaky gut. And so the treatment generally, the first step is you probably have too many yeast. All right. So if I see a story where somebody has a lot of food sensitivities, I'm usually going to treat for intestinal yeast overgrowth. That's where I'm going to start. I also am going to do a lot of questioning to try to figure out if they might also have a parasite infection there. And what makes me think of parasites is I've got somebody that lives on well water, for instance, or they did recent traveling to a less developed country and they got some kind of a intestinal infection while they were there. I might start thinking about parasites in those kind of situations too. But you want to get your infections out, okay? Number two, you may need to go on a more limited diet while you're doing that. But as you start getting the infection out, you'll probably be able to expand your diet choices down the road, okay? So the treatment is treat yeast, all right? There may be more things you need to do on top of that, but I would need to ask you a lot more questions to figure out those other parts. But at a minimum, I would look for yeast here, okay? All right. Good luck to you, Nancy. So let me show you how you can figure out if you have too many yeast as you're trying to figure that out. And I'll also show you an article that I have on leaky gut syndrome as well, too. All right, so in terms of seeing if you have too many yeast, take a look at my chapter on yeast here and look at this article called A Silent Problem, Is It Yeast? And here's where I walk you through a lot of symptoms that make you wonder about it. And notice I talk about food allergies and sensitivities right here. That's one of the big problems that makes you think about it, okay? All right, and down here, I go through what the symptoms are, but there's also a questionnaire you can fill out right here. Click right there. It'll bring up the questionnaire. If you score over 140 on the questionnaire, it often means you have too many yeast in the intestines. In terms of my article on leaky gut syndrome, you can link to it right here. Let's see if that link still works. It does. Okay, so this is the article I have on leaky gut syndrome, where I do a similar explanation to what I just did with you here. Okay, all right. Let me go back here. All right. Good luck to you, Nancy. Hello, Mike. Let's see. Hi, Dr. Ross. I have a question. Excuse me. I have a question about disulfiram dosage. What would be the target dose of enteric-coated disulfiram be for somebody weighing 200 pounds? My doctor prescribed me enteric-coated disulfiram with a target dose of 500 milligrams per day, and I'm worried this dose is too high. What do you think? Okay. So generally, what you want to do is you're going to dose your disulfiram before correcting for it being enteric-coated. I'll talk about enteric-coated in a minute. But the way we calculate out a disulfiram dose is you're going to dose at 4. Your target is 4 to 5 milligrams per kilogram of body weight a day. All right. So you see you're 90.7 kilograms. 4 times 90 is 360. 5 times 90 is 450. Okay. So, if you weren't doing enteric coated, 500 milligrams a day would probably be a reasonable target. There is some reason to believe, though, that enteric coated capsules are absorbed more easily and in larger amounts than non-enteric coated capsules. And a correction that I like to use when I'm using enteric coated is to take my total dose that I would use with non-enteric coated and divide it by 2.6. So in other words, you're getting more than twice is what you need here, basically. Okay. So let me just see if so 90, bear with me. I want to just do a quick calculation here. Yeah. And then divided by 2.6. Yeah, I might actually shoot more if you were my patient and you're not. So how I would do a situation like this is I would probably dose about 175 milligrams is somewhere or a little bit lower than that. Okay. But again, talk to your doctor about it. They may have a different opinion. And but I usually will try to not use as much, and a factor of 2.6 is what I use. Okay. All right. Good luck to you, Mike. So what you may want to do is talk to your physician. You might want to show them the article that I've written about this. So take a look at my, where am I going to have it? Let's just do that. I'm going to just type disulfiram in here. Okay, so this is my disulfiram article, and in here I talk about the chances it will work. I talk about when and why you might want to consider using it. I even talk about the fact I don't think it works for Bartonella. And then I talk about how to dose it down here. And I even talk about different supplements you might want to use along with it. In here, I do talk about how to do an adjustment. I'm sorry, it's 2.2 pounds. You want to divide it by. I'm sorry. I talk about the adjustment you want to do in this section as well, too. Okay. All right. All right. Good luck to you, Mike. Thanks for that question. Hello, Yvonne. Let's see. Good evening, Dr. Ross. Can you provide an updated opinion regarding ivermectin as an alternative adjunct to COVID vaccination for prevention, early intervention, and long hauler syndrome? I did look at your comments and your recommended protocol. It was posted December 18th, 2020. And there has been more research and information since then. Also, do you have an opinion on the overall commentary of the FLCCC? Also, do you think that ivermectin can help to quell certain kinds of systemic inflammatory responses for people with vector-borne infections? If so, what types of inflammation and other immune reactions does it work best for? For example, cytokine storms, MCAS, systemic histamine response, and so forth. Lastly, are there any concerns about ivermectin increasing as well as decreasing blood pressure? And are there any contraindications that average person attending this seminar should be aware of? Thanks. All right. So I have looked at the FLCCC. Everyone is a group of physicians that are behind efforts to try to promote the using ivermectin, especially in COVID. And they are promoting it for the treatment of COVID. They're also promoting it as a way of preventing COVID infection too. I have looked at their science. I think it's questionable. There is some science that does say it might work, but the overwhelming number of studies that they base their findings on are subject to a lot of bias that calls into question whether it really does work. And at this point, I still think the jury is out as to whether ivermectin is useful at treating either acute COVID-19 or as something you could take as a prophylaxis to keep from getting bad consequences of COVID-19. To date, the only treatment we have that prevents you from getting bad outcomes from COVID-19 is the vaccine. That's it. It's got solid studies that show it prevents 95% of people from getting hospitalized or developing bad COVID. That's the only thing we know for sure works at preventing COVID. And you can just look at the world around us here in the United States. Right now, in most places in the country, the only people that are in the hospital from COVID are ones that did not get vaccinated. There's your proof that the vaccine works, okay? The vaccine does work to prevent COVID and bad outcomes. Ivermectin may, but if it was me and I want to do something that absolutely does work, I don't want a may with COVID-19. I want to really that it does work. That's your vaccine, okay? So that's number one. Number two, in terms as to whether it really does help long haulers, we don't know. I mean, no one's done studies that have looked at people that are valid studies, I should say, that are long haulers to see if it does help or not. I have used it in a couple of long haulers, and to be honest, I just did not see much benefit from it at all. That doesn't mean it won't work. I just haven't seen much benefit from it. In terms of it being something that can manage inflammation and Lyme, I just don't see the data on that. I don't see any proof that it does. And I think that ivermectin, ivermectin is everywhere. Everyone's talking about ivermectin now, and it has become kind of an it treatment for Lyme, for one thing, and it has become definitely an it treatment for COVID, especially among those that side with not doing vaccinations. They keep saying, well, we just give everyone ivermectin, that would take care of it. And I just don't agree that the science supports that. It may, but we don't have high enough quality science to say that it does, okay? Anyhow, the ivermectin story will prove out over time. As many of you that have done Lyme know, for years, we have an it treatment of the season on most years that everyone flocks to. A number of years ago, everyone was getting LDA and LDI. Before that, everyone was doing, trying to do their doTERRA essential oils, et cetera. I mean, I can tell you the treatment of the season. Right now, everyone's attention is captured by ivermectin, and I personally am very skeptical that it's doing the number of things that people think it's doing. Okay, so anyhow, that's my opinion on it, Vaughn. The only treatment that's been shown to make a difference for COVID-19 death and outcomes is the vaccine. Okay, all right. Good luck to you. Hi, Dr. Ross. In the Leaky Gut article, you mentioned taking 2 capsules of thorn Saccharomyces Boulardii to help with leaky gut. Is this the dose that would be used for Candida albicans prevention? How many billions is it equivalent to? If so, do you take both capsules at the same time or separate them throughout the day? Is it necessary to remain on an herbal such as Capri Plus? Or will the Sacro B plus a probiotic be enough to prevent Candida from returning while taking antibiotics? Also, are there any medications or supplements that should be taken with, shouldn't be taken with ricin? All right, so last part of that. Rhizonate, everyone, is a product made by Integrative Therapeutics, of which the predominant herbal in it is licorice. If you chew licorice tablets, your saliva and licorice mix together, and that creates a gelatinous microscopic coat that can coat the food pipe and the stomach, and can prevent heartburn and stomach irritation, basically. Okay, so it provides a protective barrier. I'm not aware of anything you can't take with it, to be quite honest with you. I haven't seen any interaction problems I am aware of. And as I've studied, I don't think there is anything. Okay, all right. In terms of, actually, we'll look at a website together here in a minute to make sure, but I'm not aware of anything. Okay. All right, and then in terms of Candida albicans prevention, so I don't think of, and I'm not sure what I wrote in that article at this point, so I don't remember word for word. All right, so I think of Sacro B. Sacro B there's a number of germs you can take that help support intestinal health. Okay, one of those are bacteria, and that would be, you can either do the spore-forming bacteria that we talked about earlier tonight, or you could do human bacteria. You can also take healthy yeast, of which the healthy yeast is Saccharomyces Boulardii. All right. Saccharomyces Boulardii has been shown to be helpful at treating and preventing infections from Clostridia difficile or C. difficile. So our intestines have a bacteria that live in it called C. diff. And C. diff is one of the rare bacteria in the intestines that will grow too much when you're on antibiotics, and it will release toxins that give you diarrhea. All right. So I like using the Sacro B not as a preventive for yeast, but rather as a preventive for C. difficile, basically. All right. If I have people take it, I'm going to have them do at least 2 pills, and you can take it all at one time. If you are taking it with your anti-yeast herbs like a Capri Plus, I would take it away from the Capri Plus, because the Capri Plus kills yeast, including Sacro B. All right. So you want to take it kind of in the middle. So if you're doing your Capri Plus in the morning and you're taking Capri Plus at night, try to do your Sacro B, Saccharomyces Boulardii in the middle of the day. Okay. In terms of yeast prevention in your intestines, you want to be on a combination of probiotics that are both the spore formers and the human strains, as I mentioned earlier. One product that includes both would be the multi-biome by Research Nutritionals, 1 pill 1 time a day. Or you could do a combination of HMF, which has human strains, and your spore formers would be your core biotic. And you can take those all together as 2 pills of each 1 time a day as well too. Okay. Now, did I answer all of your questions? Let me see here. Yeah, I think I did answer that. Okay, now we're going to do a screen share here. We're going to go look up something together. Let's see here. Okay, so therapeutics. All right, we're going to the Integrated Therapeutics website, and we're going to look and see. They have a section, usually with their medicines, that talk about interactions. So let's look this up. Okay, so this is their Rhizonate page. And they have a section here called Interactions. And it looks, I guess they do have some possibilities here. So you may want to take a look at this list. They do list out a number of medications for which licorice can have some side effects. Okay, so take a look at this later. So go to Integrative Therapeutics website and take a look at this interaction section here. Okay, evidently it helps a number of things work better too. Okay, so anyhow, yeah, take a look at their website here. Okay. I'm in the process of updating my product pages, and I will in the future. And actually, this is a product I'm going to be getting to soon, where I'll be listing out some of those interactions. I just don't have it on that page right now. So that's why I would take a look here. Okay. All right. All right, Tammy, good luck to you. Hello, Dave. Hello, Dr. Ross. Hold on here a minute, Dave. Hello, Dr. Ross. I was diagnosed with Lyme, Bart, and Babesia a few years ago. Recently, after drinking a fairly significant amount of alcohol for Father's Day, my heart rate that evening increased in the range of 110 and stayed above 100 for about 20 hours. It then returned back to normal. This has never happened before. I let a few days pass and had a glass of wine, and again, my heart rate went above 100. Seems like now drinking alcohol increases my heart rate. Had an EKG and all is normal. Do you think one of the bugs I have is now causing this? Have you heard of this happening to Lyme patients? Thoughts, things. So no, I haven't heard that happening to Lyme patients, that alcohol would cause some type of heart rate variability like you're getting here. Of the germs, the ones that give you some. So the Lyme itself can sometimes cause some electrical conduction problems in the heart. That's the Lyme term. Both Lyme and Babesia can sometimes lead to some instability in what's known as the vagus nerve. That is what controls adrenaline. So if you get adrenaline surges, you could have racing of the heart too. But it's hard to say if that's what's causing a problem here. If you were my patient, what I probably would wind up doing is working with my cardiologist. I would want to see if you could wear something called a Holter monitor. And during that period you were on the Holter, I would see if you drank some alcohol to see exactly what is the electrical pattern that's happening, so you can get some ideas about what to do about it. Okay. That's how I would approach it. I would talk to your own physician about that to see what they say too. Okay. All right. Good luck to you, Dave. Hello, Kate. Hi, Dr. Ross. Is sudden sensorineural hearing loss common in Lyme? Do you ever see this? It happened to me after taking artemisinin, but I have seemingly regained all of my hearing back. Luckily, thanks. So I have not. I've been treating Lyme in my practice since 2004. So it's coming up on. We're getting near the 20-year mark here, I guess. Wow, that's kind of hard to believe when I think about that. But yeah, it's been a long time. I've never seen anyone have sensorineural hearing loss. That doesn't mean Lyme could not cause it, but I would say it's not a common thing I would see. I have seen people have more of auditory hypersensitivities, but not actual hearing loss. All right. That's not to say Lyme couldn't. I just haven't seen it, and I don't think it would be a common thing that most Lyme doctors would have seen in their practice either. In terms of artemisinin, it's possible you had some kind of a toxicity side effect of it. It's not a common one I would see either. I haven't seen it happen in artemisinin, but there is a rule of thumb I have in medicine. And many of you that have heard my webinars have heard this one before. It's Marty Ross MD rule of medicine side effects, which is anything can happen to anyone with anything. All right. And that means there are common side effects. Those are the ones you can read about on the internet. You can find in your drug directories. You can find in your supplement directories. And then there's the things that happen to real people. All right. And because each of us is designed a little bit different than the other person, some of us have some really strange reactions to medication sometimes. And so it's possible the artemisinin might have caused that, even though I would not say it's a common thing I would see with artemisinin. Okay? All right. Good luck to you. Hello, Dominic. I say hi, Dr. Ross. Can I safely take liposomal glutathione and thorn 500 curcumin, 1 pill 3 times a day? Oh, we already answered that earlier. Hello, Anna. Let's see. Hello, Dr. Ross. I will be doing yeast regimen. I scored high on your questionnaire and got your supplements. What are your thoughts on this? Nystatin, 1 million international units twice a day. Substitute fluconazole stomach cramping with Capri Plus, 2 caps 2 times a day. Probiotic by Research Nutritionals, 2 capsules once daily, coupled with Saccharomyces Boulardii, 1 to 2 caps daily. I was advised against taking the HMF4 probiotic due to possible SIBO in the past. Is it right? In the future, I would like to combine yeast with mold protocol. Is it okay to add binders of a detox to Beyond Balance or cholestyramine? What to watch for? Can you cure yeast overgrowth with yeast-free, sugar-free paleo diet only? Thank you kindly. All right, so I have not, to answer your last part of your question, can you cure yeast overgrowth with diet only? It depends how severe the yeast overgrowth is. If it's a minor problem, it's possible you could basically starve your yeast, and then I would also probably still use some kind of probiotics to repopulate and to fight the yeast. So it's possible. I think it's harder to do though, okay? All right. In terms of your regimen, the nystatin coupled with Capri Plus, that's a good combination to kill yeast. I think that's a reasonable substitute. Again, the Saccharomyces Boulardii I talked about earlier, I really wouldn't consider to be something that's going to help get rid of Candida. But because we have Saccharomyces Boulardii naturally living in our intestines, if you're on an anti-yeast treatment, you could make an argument that you want to replace what is being taken out by the antifungals. Now, I don't normally do that, but you can make an argument to do that. And if you were to do the Saccharomyces Boulardii, I would do it at somewhere in the middle of taking your nystatin and your Capri Plus, okay? Probiotic is a good idea. There's a controversy over the HMF forte and human strains of probiotics. There are some people that actually, it's a very individual thing. There are some people that being on regular probiotics actually do help SIBO. There are other people that make it worse. And there's not a one size fits all here. But in general, if you've had SIBO before, I would probably shy away from doing regular probiotics. And in your situation, I probably would just stay with the spore formers like you're doing with the probiotic. And again, you could or could not get some benefit from the S. Boulardii, but that's going to be more benefit by not knocking out the stuff that you already have in you by replacing it, okay? All right, let's see. So could you add binders while you're treating yeast? Yeah, I do that in my practice. I don't have a problem with people doing that. In terms of what to watch for, I mean, with both killing yeast and with removing mold toxins, you may be triggering more cytokines, right? You might, as you kill yeast, trigger a Herxheimer reaction, which could lead to more cytokines being made. So Herxheimer reaction is your immune system sees dead bug parts from killing them and reacts by making more cytokines. And as you know, we all talked about cytokines earlier tonight. Cytokines give you most of your Lyme symptoms. So sometimes as you start killing germs, you can have a flare-up in what you call Lyme symptoms, which are really excess cytokine symptoms. As you start pulling toxins out of you by binding them when you have mold toxin illness, that sometimes can also trigger the movement of those toxins, will trigger more cytokines to be made. Now, that's technically not a Herx reaction, but it is a cytokine surge triggered by moving the toxins out. Okay, why isn't it a Herx reaction? Well, Herx reactions only occur from the immune system seeing dead germs, not from the immune system seeing a bunch of toxins moving around. Okay, so it's kind of a semantic issue. The end result's the same. You get increased cytokines either way. Okay, all right. Good luck to you, Anna. Hello, Bet. Let's see. I have a friend who told me the other day that several weeks ago she was bitten by a tick and had the bullseye rash. She is in her mid-60s and is not taking this seriously. What are the odds of her coming down with classic Lyme and its debilitation? Good question. I wish I knew. So the only way to know this would be for somebody to do a study where we took people that had tick bites and got a bullseye rash, and we followed them over years to see what percent of people eventually get sick. Okay, that's the only way to know. It's possible. So clearly a bullseye rash and a tick bite means she did get Lyme. Okay, that's diagnostic of Lyme. Now, does it mean that everyone goes on to develop chronic Lyme, though? And the answer is probably no, not everyone does. Keep in mind, we all have immune systems, all right? So our immune systems in many people may be capable of removing Lyme, getting rid of it. And the trouble is, no one's done the long-term studies to know if we don't treat an acute tick bite like this, what percent of time do people go on and become chronic and develop chronic problems? And what percentage of the time does the immune system just step in and do its job? Okay, I don't know. Honestly, don't know. All right. Good luck, Beth. Hello, Thomas. Let's see. Any suggestions for psoriasis triggered by Lyme, or is it a fungal infection, rash on scalp and left shoulder? So, boy, I would need to ask a lot more questions about what these different rashes are. Okay, so there's a psoriasis rash, which usually has thickening of the skin and some plaque. There can be a type of rash seen in Lyme and immune suppressive disorders, which is called seborrheic dermatitis, that shows up in the scalp, which is dandruff, basically. And it's also possible to get separate fungal infections on the skin as well, too. So I don't know what's going on with the other rashes you got in the head or the scalp without actually being able to hear more about them, or possibly even being able to see them. Okay, rashes are hard to diagnose without seeing them to know what's going on. So can Lyme trigger more of a psoriasis rash? Yes, it can. If you have active yeast in your intestines, also from being on a Lyme treatment, that can trigger more active psoriasis too. So one thing I always say, when rashes get worse and you're on a Lyme treatment, always question if there could be too many yeasts in the gut. Too many yeast in the gut release toxins that get absorbed into the bloodstream. They go through the bloodstream out into the skin, and they will flare up rash-type syndromes, whether it is psoriasis, seborrheic dermatitis, dandruff. It'll make them look worse. So I showed you earlier tonight how to figure out if you might have too many yeast with my yeast article. At a minimum, Thomas, you might want to start by looking at that. Okay? All right. Good luck to you. Hello, Brandy. Let's see. Which infection goes after throat and diaphragm, giving a weak voice? So just based on what you put here, which is limited amount of information, obviously, I think you can understand. I like a lot more if I'm visiting with a patient in my office and I don't get to ask you these questions in this format. But, a weak voice could be because the diaphragm's not moving enough air, or because the muscles of the voice box aren't working correctly, or the nerves of the voice box aren't working correctly. So it could be a neurologic problem, basically. And what would give you neurologic issues in Lyme and in tick-borne illnesses is the Lyme germ can, and also Bartonella can. So those are two infections you might want to think about, okay? Now, Bartonella doesn't usually just give you neuropathy. There's usually going to be other symptoms you're going to have suggesting Bartonella. Key Bartonella symptoms can be things like pain in the soles of the feet, having a lot of neuropsych issues like bad anxiety, depression, OCD, severe cognitive impairments, tremors, shaking, sometimes air hunger, sometimes pain in the balls of the feet. Those are things that make me think about Bartonella being there. Okay? All right. Good luck to you, Brandy. And do a quick screen share here because, Brandy, I'm going to show you where you can help figure this out a little bit more. All right. So to figure out if you could have Bartonella as part of what's happening here, take a look at my section here called How to Diagnose. And take a look at this, How to Diagnose Bartonella and Chronic Lyme Disease. I review the symptoms and testing as well, too. Okay? All right. Good luck to you, Brandy. Hello, Marshall. Let's see. Hi, Dr. Ross, and thanks for all of your time and help. You're welcome. I'm about to finish a 6-week course of Doxy, 2 times 100 milligram tablets per day for acute Lyme. And your view, is this long and strong enough dose? And should I consider switching to herbal and microbials to ensure I don't have any persistent for MS? Okay. So for acute Lyme, and I guess I would need, here's a general rule of thumb, okay? And again, when you say acute Lyme, I don't have a full picture of what symptoms you had or how you reach that conclusion you have acute Lyme. But acute Lyme usually means Lyme disease that occurs with symptoms of Lyme that occurs relatively close to having your tick bite, okay? So usually symptoms that start manifesting usually probably within about 4 to 8 weeks of having a tick bite. I'm going to say that's acute Lyme, okay? Typically in that kind of a situation, a 6 to 8 week course of antibiotics will work, but there can still be about a 15 to 20% failure rate on that. So generally, when I'm treating somebody for acute Lyme, my rule of thumb is I want them to be symptom-free for at least 1 to 2 months before I stop treating with antibiotics. I usually like to go a long time to make sure I get the germ completely wiped out, okay? That's how I handle it, all right? So I don't know how long you've been symptom-free. I would make sure it's probably for at least a month. If it isn't, then you might want to talk to your prescriber about staying on your prescriptions longer. That would be how I would approach it, okay? All right. Good luck to you. Hello, Julia. Hi, Dr. Ross. Thank you so much for taking the time to answer our questions. You're welcome. I'm currently taking Hutania, the HH capsules by Zong, cinnamon, clove, and oregano by doctor-inspired formulations, and trimethoprim because I'm allergic to Bactrim to treat Bartonella. I was thinking of adding a tobabark and cat's claw to treat Lyme. Do you think this is a good protocol, or would adding the tobabark and cat's claw be too much killing action? So everyone, the Hutania is going to kill Bartonella. That's what we think it does. The trimethoprim can kill Bartonella. I wouldn't call it the strongest treater, but it could. And then the cinnamon, clove, and oregano is useful for treating growing Bartonella, removing biofilm slime layers that cover the germ, and for treating the growth state known as a persister state of the germ. All right, so what does that mean? Well, Lyme and Bartonella both have growing states, and they have about, according to lab experience, maybe about 5–10% of the germ goes into a hibernating or persister state where they stop growing and traditional antibiotics don't work to touch them. Okay, right? And so that's caused a lot of research to start being done to figure out what do we do about those persisters. And so persisters in Bartonella were only discovered about a year ago. That's a new concept. And so the main lab that's been doing a lot of research looking at what to do for persister Bartonella is Dr. Ying Zhang's lab at Johns Hopkins University has been publishing a number of studies that are laboratory experiments, of which cinnamon, clove, and oregano oils were found to be effective at removing biofilm and also at treating persister forms of Bartonella. Previous research by Dr. Ying Zhang also showed that those herbs are also effective against persister Lyme germs and can remove Lyme biofilm as well too. All right, so that cinnamon, clove, oregano is part of a Lyme and a Bartonella treatment, actually. Okay. In terms of otobobark and cat's claw, they are part of a Lyme germ treatment, and they are two herbs that had some studies done a number of years ago by Dr. Eva Shoppe and her Lyme disease research group in New Haven, Connecticut. And she was able to show in laboratory experiments that they actually kill the spirochete form of the Lyme germ. That's a corkscrew-looking thing. And then Lyme has another form that it can morph into called a cyst. Keep in mind, spirochetes and cysts have growing and persister states. So a cyst is not a persister, okay? A cyst is a cyst, okay? And so you can have growing and persister spirochetes and cysts, all right? Anyhow, her experiments, Dr. Eva Shoppe's experiments, showed that a combination of otoba and cat's claw are very effective in the lab at killing spirochete and cyst and stripping out 100% of biofilm slime layers that cover them, okay? More recently, Dr. Ying Zhang and his research group at Johns Hopkins did a study showing that cat's claw probably also treats persister Lyme, all right? So otoba and cat's claw may be a good Lyme growing and persister treatment. Gets rid of biofilms and also appears to treat spirochete and cyst forms as well too. Good treatment, all right? It's a combination I have added to a regimen like this. I will treat Bartonella and sometimes add those in. To answer your question, can you handle it? It depends on how you're doing. If you're done having Herx reactions from treating your Bartonella and you think you could handle adding more things that might lead to more Herxing, then in my practice, I would, with my patients, go ahead and add. As I add an otoba and a cat's claw to this kind of combination, I would start at 5 drops twice a day, and I would increase by 1 drop per dose per day until you reach about 30 drops twice a day, okay? If you are Herxing, stop increasing until that Herxing gets better, okay? All right. Anyhow, good luck to you, Julian. Hello, Michaeline. Let's see. And I'm not sure if I said that right. I'm sorry if I butchered that up. Let's see. Hello, Dr. Marty. I wrote a note to you on your website last week, which included a request for an initial consult. As I haven't yet heard back, I'm wondering whether you are accepting new patients. I have received line tips number 1 to 8 in my email, and I'm grateful for these. Thank you for your dedicated efforts to help those of us who have been battling Lyme for so many years. Your website's a wonderful resource. So at this point, no, I'm not taking new people, and there's a couple reasons for that. Number one, my practice got full. In fact, I had gotten so full, I was having a hard time managing my existing patients and not having enough time for when they had acute needs. And so I had to stop taking on new clients. There's a second reason, though, that I'm not taking on new clients, and that is I've had some staffing changes here recently. And I want to give my new staff more time to get familiar with my practice before I start taking on new people. It is likely going to be about 2 months or more before I start taking on new people. And so I just want to make you aware of that. I'm having some staffing issues, mainly because one of my key staff has gone out on a pregnancy leave, which is great. I'm very glad for her, but that's created some changes here. And then also I just got too full. I was not having enough time to get home and do the things I needed to at night. And I was having a hard time meeting the acute needs of my patients. So unfortunately, I'm out of action for new patients for a bit here. Okay. All right. Good luck to you. Hello, Mike. Let's see. Hi, Dr. Ross. I have a question about Disulfiram. Oh, we already answered that earlier. Hello, LM. Let's see. Do you have advice regarding what foods enhance the healing of Lyme and what foods to avoid? So generally, I want to have people on what I would call anti-inflammatory diets. Okay, things that remove foods that are thought to be inflammatory. Right? And those fall into two categories of diets. You could either try a Mediterranean style diet, and you could Google that Mediterranean diet. All right, you could easily find resources that looks at how to do that. Generally, Mediterranean diets are thought to be very low inflammatory. All right. The other option you could take a look at would be to do a paleo type diet. But you want to do a paleo type diet that is plant forward, meaning it relies on a lot of plants as part of it, and does not emphasize meats that are high in inflammatory fats. So for instance, you could do a paleo that uses beef, but you want it to be grass-fed beef, because grass-fed beef tends to have fats in it that are not inflammatory, versus non-grass-fed beef tends to have inflammatory fats in it. Okay. For an example of that type of paleo diet, let me show you what you can take a look at. I'll do a quick screen share here. Oh, before I do that, the other key part, and it is, you would find this either on the plant forward paleo diet, or it's not necessarily emphasized in a Mediterranean diet, but I would also remove gluten. Gluten in many people is inflammatory. Doesn't mean they have full-on celiac disease or allergies, but it can be very inflammatory. So generally, I have people remove gluten as part of both of those as well too. Okay. Limit alcohol or remove it. Alcohol is inflammatory. Get rid of red meats. That's not grass-fed. That's inflammatory. And then look at the food choices in a paleo or Mediterranean and a plant-forward paleo. So let me do a screen share here for that. All right, so take a look at, in terms of the plant-forward paleo type diet, and I say plant-forward, it still has some animal proteins in it as well too, but take a look at my nutrition section here. Take a look at this diet called the Best Brain Inflammation, Pain, Energy, and Detox Diet Ever. This is a diet that was originally put together by the Institute for Functional Medicine, which they at the time did allow me to reprint their resources here because it's for patient education. And you can see how to build that type of a diet. And what do I mean by a plant-forward paleo type diet? Okay, all right. It has resources that tell you how to put it together as well too. All right. All right. Good luck to you. Jim, quite often when I'm treating for Lyme and co-infections, I will wake up in the night feeling nausea, which disturbs my precious sleep. Almost never nausea in the day, only overnight. Would taking DGL before bed help prevent the nausea? If so, any idea how much to take and exactly what and when? Would taking it when I wake up feeling nausea help to stop it quickly? Also, is there a rough white blood cell count number that you find the best to be at? All right, so with what you're describing here, if I had a patient that described that to me in my practice, what I would do is I'd have them chew 2 deglycerated licorice tablets before bed. Do it about 30 minutes before you go to bed, and see if that helps. It may or may not. The only way you're going to know is to give it a try. If you were to wait until you wake nauseated, typically licorice is going to take about 15 minutes or so to settle it down. So you could do it at that point if you wanted to as well too. And the only way you're going to know if it's going to work is to give it a try and see. Okay. In terms of white blood cell counts, so depending which lab you're looking at, usually at somewhere around a 3.6 or 4 or higher is considered normal, and somewhere up to about 10 to 12. So a range of about 4 up to about 10 or 12, depending on the lab, it's going to be reported to be normal. So yeah, it'd be great if I could have everyone in normal range. I will tell you though, often with chronic Lyme, that's not possible. And then the other problem is sometimes the medications we put you on, the antibiotics, suppress the bone marrow, causing even low white blood cells. So when I'm in a treatment with somebody with Lyme, I'd like to try to do what I can to keep that white blood cell at about 2.0 or higher. Okay? All right. Thanks for that question, Jim, and good luck to you. All right, everyone. That's it for me tonight. It's been great to be here again with you. I know I was off last week. As you know, I take every 4th week off, sometimes more often than that. So what we're doing here in July, I've got a webinar today. I've got one the week after, and we'll have one the week after that. Okay, so we have 2 more coming up, and then I'll be off for a week. I guess that actually is occurring in a week. I don't actually get a break that week. I'm going to be out helping my dear old dad move into assisted living. So I'll be venturing back to Colorado Springs to help him do that week. But so it's good I don't have a webinar that week. I can be there to help him. So tomorrow morning, keep an eye out in your email. You'll get an email from me announcing that the recording from tonight is ready for your review. When you get that email, it also has links in it to sign up for next week's webinar as well too. I'd appreciate it if you think you know people that would benefit and get help from these webinars, that you share the video email with them tomorrow and the links to sign up for next week's webinar. Okay. My goal is to help as many people as possible, and you help me do that. So I ask you to help me do that. Okay. And so I look forward to seeing you next week. And good night, everyone. Good to have been here with you tonight.